There we go.
Good evening, everyone, and welcome. Thank you for joining us for this important topic, men's health discussion for male factor infertility. Tonight, we'll explore a topic that affects far more families than many people realize, yet one that is often misunderstood and not talked about very openly enough. Male factor infertility contributes to nearly half of all infertility cases, but many men are still unaware how fertility health connects to the overall health and well-being. We are very fortunate today to be joined us by an incredible panel this evening. So Brian Maza, who will share his personal fertility journey, alongside of Dr. Shapira from Reproductive Biology Associates, and Dr. Ali Domar. She's our Chief Compassionate Officer for a Prelude Network. And throughout the discussion, we encourage you to submit all the questions by using Q&A box. And if you prefer to ask your question live, which we certainly enjoy listening to questions directly, please leave and raise your virtual hands up and I'll unmute you and you can ask the question directly to our experts. And whether you are personally affected, supporting a loved one, or interested in learning more, we are grateful you're here today and we'll get started this conversation.
Thank you so much. Thank you everyone for joining us tonight. You're in for a treat, and I'll just jump into it. So tonight we're going to go over a bunch of different things. We have a bunch of questions. I'm going to talk about my journey as well, but 95% of men say living a healthy lifestyle is a priority. Less than 70% of men have strong understanding of fertility health, and the biggest misconception of them all is that infertility is a women's issue. I thought that as well, and until I went through it, I was, didn't really think it was going to be me, and I was the problem. So in this webinar, we're going to destigmatize that infertility is a woman's issue. We're going to encourage men to make fertility health as part of their overall health goals. We're going to educate participants on the cause and the treatment of options for MFI, including sperm donation and the spotlight Inception's new brand, My Sperm Bank. And we're going to open discussion towards the end on how my MFI impacts relationships. So we're just going to jump into my story quickly before we go into the professionals here that are going to hopefully educate us on everything. But my personal journey started in a really beautiful way when I met my wife. I knew I was going to marry her the first time I met her, and we were super aligned on when we wanted to have kids, how we wanted to have kids, what the time and place, and how we wanted to really see this unfold. We had two both huge budding careers. I was a president of a $100 million hospitality group in New York City. She was at CNN, and her career in journalism was growing pretty rapidly. And I had a young dad at 32 years old, and I knew that I wanted to be a young dad as well. And be around and play sports and be really, really involved in my kid's life. So we decided, after 1 year of marriage, that we were going to try this journey of becoming parents. And it was not working out. And it was not fun because it was not working out. And that's when things became really stressful. And you're having other friends that are going through that same journey. And right away they start getting pregnant. And then you start now comparing lives and what's going on and what are you doing? What am I doing? And the animosity got really, really troubling between both of us until we started to figure out what was going on. So, I remember the first time my wife said, "Hey, you need to go get your sperm checked." And I got really defensive on it. I was like, "Why am I the problem? I'm super healthy. I'm in incredible shape. My blood work is great. I was just on Men's Health cover twice, so I was totally oblivious and totally neglecting that I could be the problem here." And I can't take the full blame on it though at that moment because no one was really talking about male factor infertility then. No doctors were really talking about it in my circle. I didn't really read any publications about it. It wasn't something that you talk about. And the crazy part is like, when you'd go out with my buddy, when I would go out with my buddies, the conversation would go, "Are you and your wife trying to have kids?" "Yeah, it's not working out." And then it changes the conversation really quickly, and you're talking about, "Oh, the Knicks are on tonight," and you don't even really get into the weeds. But I was noticing, and my wife was noticing when she was going out with her friends, they were more open about it. They were talking about their struggles. They were talking about what was going on. But men never talk about it because you don't feel like a man. And I did not feel like a man. I was excelling in every other part of my life, but I could not get my wife pregnant. Almost to the point where I sat her down and said, I think we should get a divorce because if I can't give you any kids and we can't have kids together, I want you to be able to experience that with someone and really do it the right way. And, we stuck together, and through all the trials and all of the BS back and forth and the constant letdowns of me being the issue, we ended up having and going through IVF, and we went 2 for 2, luckily, and we have two beautiful rocket ship boys right now that are 8 years old and 6 years old, are two miracle babies. And that whole pregnancy journey wasn't a picnic and a high five either. There was many complications, and we didn't think Leo, our first son, was going to make it early on, and he ended up pulling through. So this journey was incredibly tough. This journey was not fun at all. But no man around me, no men in other groups were ever talking about this as a problem. And I decided to take it upon myself to be more vocal about it and hopefully spread some light on the situation and destigmatize it. In 2020, I ran 50 miles. And raised over $81,000 to help 3 families go through their own IVF process because I do know how expensive it is if your insurance does not cover it. But all in all, the outcome was unbelievable. The journey to get there was crazy. And I'm just being real and honest with everyone here. It was not fun. It was not enjoyable. At times, I wanted to stop. At times, I wanted to quit. And I wanted to hide under a rock because I was the main problem. So it definitely impacted the relationship with my wife. I always joke with my wife still. I'm like, that's why you still hate me because we had to go through all of this. But we have two beautiful boys, so it was a successful time, but the journey was definitely very tough. I'm gonna jump, so that's my journey. If anyone has any questions at the end, we could talk more about that. Um, and I'm gonna jump into handing the mic off to Dr. Shapiro. He's gonna go into some of his talking points and get us all educated on some more stuff. So thank you.
So, hi, my name is Dan Shapiro. I'm the medical director of Reproductive Biology Associates in Atlanta. We're part of the Prelude Network, actually, the founding practice of the Prelude Network 10 years ago. Um, Full disclosure, I'm not a urologist. I am a reproductive endocrinologist, which means I treat infertility. And I started out training as a gynecologist. So that's my background. If I don't know the answer to future questions that are urologic in nature, we do have a urologist on staff that can answer them, and or you can ask your own urologist. So, male factor infertility is the numbers thing. It's first infertility is defined as a year or more of attempting pregnancy, no protection, and not getting pregnant. Now, if you're over 35, nobody makes you wait a year to meet the definition, and you can start of an evaluation legitimately in about 6 months and expect to find something. Um, but about 40% of the time, well, 20% of the time, no explanation is found. 40% of the time, it's a female issue. And very often that's either tubal factor or a condition that causes ovulation dysfunction. And there are several of those. PCOS, now PMOS is the new name for it, is the more common. But the other one is the marathon running former gymnast who doesn't get her period because she's too skinny. That's called hypothalamic amenorrhea. So, but on the male side, we don't have neat little categories, and it's 40% of the explanation. The more we learn about the genetics of all of this, the more it's evident that about half the time or more, the problem with the sperm was there from the moment of conception of that baby boy. That it's a genetic issue, that there are two types of genetic issues, autosomal, meaning on one of the numbered chromosomes, or on the Y chromosome, sex linked. The genes that control male differentiation, we all start off technically as female in appearance, and then the genes on the Y chromosome turn us into boys, give us our external genitalia, populate our gonads with the cells that will become sperm, and makes the male structures. But there can be deletions in the Y chromosome that are really tiny, not enough to change the differential pattern for that male, but enough to interfere with sperm production when he's an adult. And again, there are lots of genetic explanations, and that's a simplified version of what's called Y chromosome deletion. The commercial test only checks for 4 of them, and there's at least 110 of them known. So, that's a big reason for male factor. Some is hormonal. The most common reason that we see is men who take male hormone supplements. That if you take testosterone or DHEA or any of the male hormones, that suppresses the hormones in your brain that cause your pituitary gland to tell your testicles to make the sperm and the testosterone. So by taking the T or the androstenedione or any of the others, DHEAS, those are weak ones, but they still have the same effect. They shut off the hormone LH. Women make LH2. In women, it causes ovulation. In men, it causes sperm production. And if you suppress the LH, there's no signal. It suppresses the FSH2, which is follicle stimulating hormone. In women, it causes the egg to be produced. In men, it gets the sperm ready, so to speak. But testosterone suppresses both, and especially the LH. And if you shut that off, there's no signal to the testicles to make the sperm. And so the counts usually drop to 0, even if the tissue to make the sperm is actually there and normal. And the treatment for that is simply to stop taking the male hormone supplement. Now, as an aside, some men are very resistant to stopping the T because they started it because they had low libido, or they were really sluggish, or they were depressed, and the T woke them up. There's another way to tell the body to make the testosterone, and that would be to take a different set of hormones. They're usually by injection, though there is one oral hormone hormonal treatment that can cause FSH, follicle stimulating hormone, to go up in men. But there's usually injection therapy required. But it works, and the sperm counts go up, and so does the T. Aside from the hormonal reasons, many reasons are obstructive, which means that there's blockage in the tubes. Sometimes you're born that way. Men who carry the cystic fibrosis gene are very often missing their vas deferens, the tube that drains the testicle to the outside world. And if they're making sperm, it can't get out because the tube, the actual pipe, is not there. So we genetically screen everybody when they come in for male factor evaluation, specifically to see if they carry CF. Because if they do, that could be an explanation for why there's no sperm in the specimen. Other obstructions usually come from prior surgery, injury, or infection. And the guy usually knows the history and can tell you something happened. Got dinged on the soccer field, had an STD, had surgery for any number of reasons as a kid, all of which could explain how the tubes get blocked up. So those are the definable reasons for male factor infertility. But frankly, most of the time we don't find an explanation, which usually means it's genetic in nature. But genetics is more than just your chromosome count and the genes in those chromosomes. How the genes are regulated actually matters. There is a new test out there that can look at sperm even when the bulk parameters are normal. It's called Sperm QT, and it looks at what's called the imprinting pattern on the sperm. The nice thing about this test, it's a novel test. It tells you whether you should do IUI or not. It doesn't say whether the pregnancy is going to occur. But for a lot of men, their counts are normal and nobody can figure out why their wife isn't getting pregnant. And yet there is a problem with the sperm. It just can't be detected by a traditional semen analysis. So knowing, especially if your wife's 36, 37, 38, knowing that, yeah, the sperm may look good, but it's not going to cause an IUI or spontaneous pregnancy, helps move people to in vitro much quicker. And with in vitro, you can actually take the sperm and inject the egg, a process called intracytoplasmic sperm injection, which I'm very proud to say, though we did not invent it, we did have the first ICSI baby in the US 33 years ago. Yeah, it made the cover of Time, I believe. And the founder of the practice was on the Today Show. It was a big deal. But it's also 33 years ago, before I joined the practice, but still a big deal. But ICSI is what most men with male factor will ultimately get, so that their DNA, yeah, sure. so that their DNA can be in the baby. Now, IUI can work, but the pregnancy rates, especially if there's a male factor, are really low. So normal pregnancy rate for a woman who's 27 years old is 20% per month. At 37, it's about 11 to 12% per month. At 40, it's 7% per month. At 44, it's 1% per month. And after 44, it's anecdotal for other reasons that have nothing to do with the sperm. But if you know that you've got an issue with your sperm and your wife the age is moving up, you should be doing IVF quickly. But IUI, if you're lucky, 3 to 5% for severe male factor per try. And if you've got mild male factor, it's no more than 5 to 8% per try. So it doesn't even match for younger women the age-related expectation of pregnancy. It's better than nothing, but it takes a while. It delays the therapy most guys ultimately need, which is IVF with ICSI. So that's not true for everybody. And there's some men with severe male factor who will still initiate pregnancies. And I've been here long enough to know we never say never. We say we play the odds. We say, okay, and I didn't define a normal count. A normal count by traditional WHO criteria is 20 million per cc, 1.5 cc's of semen volume or more. Over 7 is considered a little gaudy, frankly, and might be abnormal in and of itself. But average is about 2 cc's. And then the motility score, anything over 40% is actually normal. And for the WHO criteria, it's 30% of the sample with normal looking sperm. But there's another measure for that called Kruger criteria. And honestly, there are plenty of guys with a 0 Kruger that's called the morphology score, who go by the name Daddy. So I wouldn't worry too much about a 0 morphology score, as I like to say to my patients. If that's the only abnormality you've got, that and $1.98 will get you a grande mild at Starbucks, but not much else. There are men who have only that as their finding, the morphology score, and there are other tests called like a DNA fragmentation index. That's very popular right now. But the DFI, as it's called for short, really that tells you who should be doing IVF, and so does sperm QT. It doesn't tell you who will or will not get pregnant. So, and which is the other issue with male factor, is there real limits to the testing, and there are real limits to the interventional therapies. So there's only so much you can test beyond just plain semen analysis that actually has meaning. And the new genetic tests might prove to be very valuable, but they're new. So we have to wait that one out. But once you find out there's either no explanation or an untreatable cause, then an IVF's the recommendation. You should move quick, because for some men, sperm counts will continue to fall if they have something known as testicular failure. I went a little off track there. But the bottom line with the testing and the treatment is it usually boils down to IVF. People who can get pregnant with IUI can get pregnant on their own typically. IUI just speeds it up a little bit, but it doesn't take people who wouldn't be pregnant and help them achieve pregnancy. It's on a faster track, but only a little faster. IVF overcomes the male factor because of the ICSI process. And so I'm trying not to go over time here, but and I think I might be talking a little too fast. But the bottom line with it is if you don't have a diagnosis, you're not alone. This will be a good segue for Ali to talk about how all this lands on a patient. But you're not alone. This is very common. Most of the time, there is not a clear diagnosis. There are lifestyle changes people can make, the most notable being to stop taking male hormone supplements. But being in good shape, yeah, that's good for you. Keeping your weight near ideal, also very important. The heavier a man gets, the lower his sperm count on average will be. So weight loss for men who are overweight is a great idea. Eat a healthy diet, plant-based or limited animal protein tends to be the best. Lots of veggies. And for supplements, vitamin C, vitamin E, and zinc. And beyond that, frankly, not a whole lot more people can do. There are some surgeries that can be beneficial, but typically for especially severe male factor, IVF is the way to go. And so I'm going to stop there and turn this over to Ali.
Thanks, Danny. So, the one thing I would say about the tea, you say it's a relatively common cause of male factor infertility is men who take testosterone or other supplements. The problem is a lot of men don't tell their partners they're taking it. And so I can't tell you how many times I've seen a couple where there was a severe male factor identified. They went through, the big workup and moved on to IVF. And then there was a little bit of a whispered conversation between her physician and the partner, where, the physician would say very quietly and not in the partner's presence to the man, if you're taking testosterone, if you're taking one of these male supplements, you need to tell me.
Right.
Because honestly, until I got into the field, I didn't know that taking testosterone rendered a man infertile. And I suspect most men don't know that, let alone the
That's correct.
women they're sleeping with. And so if you are going through infertility and there's a male factor identified, one of the first things that has to happen is an honest conversation between yourself and your male partner, or between your male partner and your physician, because he may very well be taking one of these medications that is actually causing the infertility, and he may be too ashamed to tell you that he's taking testosterone. But he's got to, because if he stops taking it, I believe in most cases within a couple months, his sperm count can go back up again and can contribute to a 3 months. 3 months, thanks. These are the little cues Danny's giving me. In 3 months, you could actually achieve a pregnancy on your own. You wouldn't need any of the fancy stuff that we provide for our patients. So that's something just to keep in mind. I will say this in no way disrespectfully to Danny or any of the REI infertility doctors that I know and love. Infertility treatment is a very sexist world still, in that if there is a moderate to severe male factor fertility identified, because there's not much known yet on how to treat it, the way to get around it is to make the female partner super fertile. And usually either to give her medications that cause her to produce more than one egg, or more commonly to have her go through an IVF cycle. Because then, as opposed to your sperm having a chance to fertilize one or two eggs, you have the chance to fertilize, 10, 15, 20 eggs, which drastically increases your chances of having a baby. So this is where I, as a psychologist, come in, because that's when tensions can start to rise, as Brian mentioned, because you may have a couple where the wife is reproductively healthy and normal, and yet there's a moderate to severe male factor. And the only way that we can get a baby out of the two of you is to put the wife through an IVF cycle, which means the injections of medications, a minor surgical procedure, et cetera, et cetera. And this is where the mental health, the emotional health comes in. Because some women are rather unhappy about being turned into patients when they are healthy themselves. But more commonly, you see a lot of guilt and shame on the part of the man. There is no relationship between male factor infertility and sexuality and virility and masculinity and macho-ness and all the stuff that men tend to associate with this. But, Brian,
All the time.
could be a highly macho guy. It doesn't mean that he produced a normal sperm count. And so for a lot of men, as he just said, men don't talk about this. They don't talk about it with their friends. Um, Irina and I met a couple in Texas recently where the husband of the couple was a firefighter from Texas. And that's about as macho a job as one can get, to be a firefighter in Texas. And what was amazing about him is that he told all his colleagues in the fire department, which absolutely blew me away that he was willing to do that. Because a lot of men will never tell anybody that there's a male factor infertility involved. And yet, we mentioned the World Health Organization, infertility is a disease. Whether it's a disease in the woman, it's a disease in the man, or it's a disease of both of them. There's very little a man has done or is doing other than taking testosterone or supplements, which is causing male factor infertility. It has nothing to do with their capacity to achieve an erection, to be a very satisfying sexual partner. It is simply a matter of biology. And so in this case, you really need to separate masculinity and sexuality versus fertility. They are not related. I'm assuming, Danny, you would agree with that?
I would agree with it. And I very frequently say to people, first of all, at least half of this is genetically pre-programmed. And so there's no shame or blame. This is Mother Nature dealing twos and sevens at Hold'em. This is the hand you got. You got to play it. Some people are born with brown hair. Some people are born with high intelligence. Some people are amazing track athletes, and some people get dealt twos and sevens. So it's not a personal thing. It's totally random. It's not fair. Um, but I find that when you take the responsibility piece, as you're saying, out of it, he's like, oh, this is genetic?
Yeah.
How? And then I explain it and I talk too much. And get way into get it way into the weeds about palindromic DNA. And people go ugh, and gloss over. But at the same time, they get the overall message, which is it ain't you, man, right? It's just the genetic lottery. And
It's a disease.
it's
It's
a
a disease.
disease, right?
It's
It's
no different
humbling,
from diabetes
right?
or,
That's right, and it's
gout
it
or
is
anything
humbling.
like that.
It is humbling, but so is getting cancer humbling, and so is having chronic pulmonary disease humbling. And so, part of the human condition, and nobody asked for it, and nobody put it on them. And the things that are lifestyle related, you can change,
Sure.
and very often
Yeah.
get the result you just said.
Yeah, but what Brian said is something that a lot of men that I've talked to have said is they feel so guilty about having male factor infertility that they say to their partner, to their wife, why don't I divorce you so you can marry a real man or a man who
That's
makes
kind of mind blowing,
sperm?
actually.
I can tell you, in my 39 years of counseling individuals and couples with infertility, I've never met either a male or female who fell in love with someone because of their eggs or sperm. And
Not
so,
in a
Brian,
relationship that lasted.
okay, there it was. So, Brian, I'm not at all surprised to hear that your wife would have far rather gone through an IVF cycle so that you guys could have your miracle little boy rockets together than to divorce you and have a baby with somebody
Right. So
else.
it was very giving of you. I think we all understand what your motive was,
Yes.
but
Probably
you
wish
know,
you taking me up
but
on that offer now.
I'm sorry.
what?
Probably wish you see took me up on that offer now.
Yeah, maybe. Well,
No,
kids
because then
can
she
change
wouldn't have
things.
her sons. Trust
But
me.
at the same time, we didn't bring it up, and Brian, clearly not appropriate for you and not necessary because the ICSI worked. But for some men, the sperm counts are that low, or there is no sperm production. It's genetically programmed that they will not make any. And for them, either adopting an embryo, which is happening more frequently, or where neither partner has a genetic component, but the wife gets the experience of pregnancy, or using donor sperm, and which is
Yeah.
a nice segue to Inception's newest division, which is
Our
called
new
My
baby.
Sperm Bank. Right. It's not my baby. No, no. This is more Allison Bloom. My egg bank is my baby, but my sperm bank is. I think Allison can lay claim to that one.
Or Cat Stillman.
But
Yeah.
I'll claim the name, right? Because my egg bank was founded 17 years ago. So, and that was the model for the new sperm bank. It's a niche kind of thing, but for couples, especially where it's a straight couple and or a gay couple, doesn't matter. Two women wanting to know who the donor is and wanting that donor designated just to them, completely understandable, which is one of the offerings of the new entity. But especially for a straight family where they don't want a billion half siblings, that show up on the cover of People magazine with, like, look at all my siblings that I found. Um, Being able to narrow down where the sperm goes, yeah, it's a novel idea. And I'll credit Allison with coming up with it. Wouldn't have thought of it, frankly. Um, but the My Sperm Bank model for some straight couples and for two women married to each other, single women by choice, who do not want their child to discover a gabillion half siblings in 20 years. They can choose a directed donor. That's what the new
So, Irina, I see a ton of raised hands. Do you want to start taking questions, or do you want
Yes.
Danny and I to keep on talking with each other?
Thank you. I didn't want to interrupt you in your discussion, but yes, we did receive a lot of questions. So I'll start with the first question, and then I will allow a patient to ask a question live. So the first question from Brian. Brian, can you take us back to the day you received your diagnosis? What exactly were you told, and what was your immediate reaction when you heard the words male factor infertility?
I love this question. Well, they didn't tell me it was male factor infertility right away. They just said I had a low sperm count. And that was the only update I really got. So right away, my ego kind of took over, and I said, "Oh, that can't be true. I have to go take another test." So I was very defensive and in denial about it. So um, just like you always want to get a second opinion about things, and you think the answer is going to be different. But actually, when I got the second opinion, the answer was way worse. So they actually brought up everything else under the sun, and therefore we had to start making some very hard decisions.
Brian, there's a follow-up question, so I can ask you right away. Did you feel shocked by the diagnosis, or had you suspected something might be wrong?
I honestly felt like a loser. I really did. I felt like not like a man. I felt like someone who just wasn't able to be there for his partner and for someone who really wanted to be a dad. Because I have a wonderful father, and that's what I really wanted to be and emulate after him. It really sucked. I didn't feel like a man. Everything on the outside was great, and I was flying in that department and health wise. But when that diagnosis came, I couldn't believe it.
Thank you.
How'd your wife react?
She was not a happy camper.
Would,
Not
would
a happy camper at all. It was a tough time.
by because of the diagnosis or because of
Yes.
your reaction to it?
The diagnosis and everything and all of that, right? Because I think Dr. Domar, you made a really good point of they become patients, right? When they're perfectly fine. And I think that was a very troubling thing for her to have to do.
Right.
And I felt really bad. Like I was like, oh God, dude, I'm letting everyone down. And we didn't tell my parents either that we did all of this because we didn't want to let them down.
Are they finding this out right now?
Yeah, sorry, mom. But they didn't even really understand it either. It was crazy about it's wild how many people have no clue about this.
No, it isn't wild. It's common. Medical education among the lay public is terrible, and a lot of it's Dr. Google. And there is good information to be had online, but you have to know how to read it. And that's the problem. Without the training, some Ungapachki study from, God knows where, compared to a very well controlled trial done by National Institutes of Health, big difference. People
Huge.
can't, it's hard for people to compare the value of what they read. So everything feels true. But most of what's online about male factor infertility, it's a segue to some, doom scroll to ads that get you to go to some enhancement clinic, which
Well,
I
I
mean,
think one of
yeah,
the problems is that when people hear that there's male factor infertility, they assume it's due to sexual dysfunction. I
yeah, that's
can't
right.
tell you how many
That's right.
patients I've had where a male factor was diagnosed and they're told, well, why don't you just take Viagra? I mean, I don't understand why you can't just take one of those little blue pills.
Right.
Absolutely no correlation.
Right. Well, and they also it can be a very negative spiral. People who connect that in their head, which, as Ali pointed out correctly, is common.
Mhm.
They might not have had sexual dysfunction at all before the diagnosis, but after they get the diagnosis, they become reticent,
Yeah.
reluctant. They start popping up with erectile difficulty. They become anorgasmic, and the whole thing becomes a chore instead
Mhm.
of an intimate moment. So, the educating people is real hard to do because people are going to feel what they're going to feel regardless of what the truth is. Um, but good counseling and showing folks that there are plenty of options, even if we're not great at specific diagnosis, and the treatment is kind of frankly crude. It's either IUI or IVF, or in some cases surgery or hormone therapy, which happens much less than people realize. I wish that hormone therapy was the cure for this. It doesn't work really, not well. So we really don't know everything we need to know about this. So it's not
Yeah.
surprising that the lay
Yes.
public doesn't know that much about it either. We don't know how to educate about it.
Thank you. I see the next patient just lower their hands. I still encourage you to raise your virtual hands and
I'm
ask
sorry, I
the
talked too
question
long
live.
again.
So I'll move us along if that's okay. The next quick, because we do have a lot of questions that are coming in, and
Okay,
I
sure.
really want to have this opportunity for patients to ask the questions to all of you. So the
Okay.
next question is actually, Dr. Shapiro, is for you. Is it possible to do insemination if man has vasectomy?
No, because
Well, you
if
can
you
do it, it
inject,
just won't get you anywhere.
there won't be any sperm in the ejaculate. And there are procedures where you can go above the point where the blockage is from the surgery to collect the sperm. It's called MESA. It's an open procedure. It requires anesthesia. It's very expensive, and the amount of sperm you get isn't worth it for IUI. It won't work. In the 35 or so years I've been involved in reproductive medicine, I'm aware of one MESA IUI success ever. So I wouldn't do that. I mean, you're better off getting a reversal and trying that. But if you can get a reversal and the sperm's okay, you probably don't need IUI. So if with guys with a vasectomy, it's either get a reversal and see what happens, or IVF with sperm collection out of the testicle.
Thank you, Dr. Shapiro. The next question is, can you discuss the impact of alcohol for men when beginning stages of IVF and creating the embryos? Is it a strict zero for 3 months, or can
No,
someone have 1 to 4 drinks per week occasionally?
no, this is easy. Alcohol bad. Okay, just it's bad. But do you have to be completely abstinent? No. But the more you drink, the worse it gets. So, a beer or one alcoholic beverage a day, no big. Once you get to two or above, at two, there might not be a problem, but you could start to see some issues. But with people who have three or more drinks a day chronically, yeah, the sperm count is very often suppressed for a variety of reasons. We won't get into the physiology of why, but yeah, it's not good. It's bad. So limit. Doesn't have to be zero, but limit.
But I think we also have to add here cigarette smoking and CBD and THC products. So it's not just alcohol.
That's correct.
Thank you. Brian, the next question is for you. What made you choose IVF right away instead of trying IUI?
We did try IUI one time and it didn't work. So I wish we would just went to IVF and went right to ICSI because that was the only way we were going to get pregnant. But the doctor we worked with basically told us IUI was not going to work, but we said let's just give it a shot.
Thank you. And while I have you, I have another question for you. Did you ever feel guilty watching your partner carrying the physical burden of the treatment?
Um, no, not during the treatment. Yes, there's two things. It's the last part is funny. Yeah, it was tough to see her go through the shots and go through all of that stuff. And I went to every doctor appointment with her to make sure everything was good. And that's what every man should do if you have the opportunity to do so with work. Um, but while she was going in labor, the week before, I tore my Achilles playing soccer. So. She actually wheeled me in during labor in a wheelchair. So we had a rough go. We had a rough go with this.
Thank you.
Wow.
Thank you. Awesome. We actually have Kyle kind of on the line with us. We conducted a webinar and interview with him last month. And Ali referenced him previously, so he mentions, "Thank you, Ali, for kind words." And exactly what you said is happened to us. They treated women before they treated the male infertility. Candace, his spouse, had to take more medication and more shots in order to fix me. So this kind of a situation that a lot of couples are facing right now.
Hey, Kyle, I think about you guys every day.
Perfect.
That's
The
another
next,
success story, by the way. They must be close to imminent with their little baby boy, right? Yeah.
I know, Kyle, I don't want to speak for you, but you're welcome to unmute yourself. I believe you guys were 26, 28 weeks now.
Oh, more than that. They were 24 when we met them.
Yes, around that.
All right, he's being shy.
The next question is for Dr. Shapiro. Dr. Shapiro, if someone with previously low hormone levels solves it, but it still doesn't not see sperm counts, motility, or meteorology improvement, what would lurking under the surface?
Well, that's a good question, and it's hard to know without knowing what the hormonal treatment was or what they were trying to cure. Um, there is one diagnosis that men have, but they kind of know they have it from puberty. It's called hypogonadic tropic hypogonadism, if you want to remember the Jeopardy word. Basically means the pituitary hormones, for whatever reason, are not produced in sufficient amount. Those men, if you give them the injection therapy, their sperm counts will come up to normal most of the time. For some men with a little bit of sperm impairment, there's an oral medication that women traditionally took called clomiphene, that can improve sperm count a little bit. And it's a reasonable first line place to stay. But without knowing exactly what they were treating or how low you started, it would be real hard to say what to do about it. Now, what else could be lurking under the surface? An obstructive problem. There are ways to diagnose it, but very few people bother because of the age of ICSI. And the genetic issues that I was referencing. If it's one of the genetic issues, it can't be fixed. It's like I said, it's nobody's fault. It's just the randomness of Mother Nature doing her dirty. But even if that's the case, realistically, the worst case in going forward with ICSI is that if it is linked to the Y chromosome, because the Y chromosome passes down the generations without being modified, then your sons, in that exact example, the sons would have the same diagnosis when they attempt pregnancy with their wives. That's what the prediction would be. That's the only the negative consequence of it. And if you can do ICSI, it's not that negative a consequence. So, and I haven't had anybody say to me, well, I don't want to take that risk, so I'm not going to do ICSI, frankly, not in 31 years. So, unfortunately, I can't answer the question, I think, the way it was intended. But there are lots of explanations. And again, most of them wind up with IVF ICSI.
Thank you. The next question is for you, Dr. Shapiro. I'm 62 and my wife is a lot younger than me. We want to have children. I had 3 children in prior marriage. My sperm analysis shows some morphology defects and somewhat low motility, but my total count is very high, and several doctors have said that it is still viable.
It's probably viable. That's probably right. So, older sperm might have other issues having to do with what are called epigenetics, which is the regulation of the genes within the chromosomes. There might be an association with autism spectrum disorders and the like when the father's older. And those would probably be imprinting defects, or there'd be selection bias to how they got to be 52 or 53 having their first kid or whatever. But regardless of that, um, you know, I wouldn't say just because it's 62, it's bad sperm. And if the count is adequate, it's just about the concentration of the motile sperm. If there's enough and your wife is ovulating and her tubes are open and she's not 46, then yeah, the odds are reasonably good. Up to age 38, you should expect pregnancy to occur. Even at 38, 39, and even 40, in a lot of women, it happens naturally. Once you get past 40, 41, 42, it happens, but it's much less frequent. And then really at 43 and above, we really don't see that much spontaneous conception.
And
Anecdotally,
there's a
yeah.
high risk of pregnancy loss at that age as well.
And that's exactly right, Allie.
Yeah.
And that's very stressful too, because there are plenty of women where the egg and the sperm get together at 43, and it's a genetically abnormal conceptus, and Mother Nature takes care of the abnormality by causing an early miscarriage. But from a patient's perspective, it's a baby and it's a lost pregnancy and it's a lost opportunity. Um, but understanding all of that in the office of a good gynecologist or a reproductive endocrinologist might help people come to grips with it, might also help direct them toward therapies that include egg donation, which overcome the genetic issue, but has other issues to deal with.
Thank you, Dr. Shapiro. I see one patient raised the hand. Sampashi, I'll unmute you and you can ask the question live. Please unmute yourself and you can speak.
They're still muted.
I can't see anybody. Oh, there we go.
Yeah, they're still muted.
Yeah, okay.
All right, we'll get back to this patient later. So, Brian, next question is for you. Was there anyone who said something that was intended to be helpful but actually hurt?
Yeah, they asked me if I was on steroids every single time I went to a doctor appointment. But after that, we just started joking because I'm in incredible shape because I do for a living. Um, so I guess that was their first response. In the beginning, it kind of annoyed me, but then I was just like, I guess I have a physique that kind of looks like that, so maybe that would be the cause. But no.
Thank you.
You're lucky.
Very. Dr. Shapiro, is there anything I can do to improve my motility? It is currently at 20% and I'm 43 years old.
Well, again, a good evaluation and by a urologist and hormonal assessment, maybe a genetic assessment might come to an answer. But the only thing that's ever been shown to improve motility scores, and it's a separate issue whether it actually improves the pregnancy rate. But I think even though the data is 70 years old, varicose seal repair um, does improve a motility score. And there's some papers that say that that's beneficial in the overall pregnancy rate. There are others that say it doesn't make any difference at all. But the
Want to
motility
explain what
score
a
does.
varicocele is?
Varicocele, yes. So the reason the testicle's on the outside is sperm production occurs at lower than normal body temperature. When it's too hot, no sperm. When it's too cold, no sperm. It's a Goldilocks zone for sperm production. The veins over the testicle that drain the blood out of the testicle are also a heat sink that radiates heat away from the testicle so it can produce sperm at appropriate temperature, about 95 degrees Fahrenheit. So 1950s thinking, and it might be right, but actually it's still not proven, is that if those veins are dilated, they're not as effective at heat sinking and they retain the heat in the scrotum. And testicular temperature goes up and sperm production goes down. That was the theory. So that if you go in and you tie off the vein so it can't backfill, it won't dilate. And if it doesn't dilate, it heat sinks better. And yeah, in some of the original studies, the motility score and in some the count too went up a little bit. But the long-term pregnancy rates were the same, treated or untreated. So there's still some controversy about whether varicocele is beneficial. It's also controversial as to whether it's really a cause of male factor infertility. But if it's symptomatic, I think the general rule of thumb is you tie it off. But what does symptomatic mean? That means you can see it yourself. It hurts when you have an erection, or it hurts when you climax, or it hurts when you walk, or it's so disfiguring because it's sticking so far out of the side of your scrotum that it looks like, alien. There are men like that. And those guys, it's like, yeah, it's enough. Yeah, you tie those off. But the ones that can only be seen by ultrasound that have no other symptoms, there's no proven benefit to tying those off.
I just said, by the way, the surgery where you tie them off is done under general anesthesia generally.
It
So
is.
you don't
So
have
the
to be
incision's not
openly.
on the scrotum. The incision's in your groin because the vein goes through there. But even so, I mean, I wouldn't want to be cut if I didn't have to be. And if I was going to be cut, I'd want to know it was going to really benefit me.
So then, I mean, there's another question about microtesia, and I'll get back to it. But Ali, there's a question for you. How can men separate the fertility diagnosis from the sense of self-worth?
I'd actually ask Brian that because he's been through it. And then I'll add to that. Brian, were you able to separate the diagnosis from your sense of self-worth or your sense of masculinity?
Yeah, I think in the beginning, no, right? In the beginning, you're like, oh my God, this is, this can't believe this is happening. You're in denial. I think, after positive doctor appointments and your partner supporting you and um, going through it together and working through problems. And, life is all about facing adversity, right? You don't know when it's going to knock on your door. And
Now we're unmuted.
so I think, like I said, life is it's full of adversity, and how you rebound and how you deal with it should define you. It's not what is going on. So yeah, I think that's the best way to do it. In the beginning, maybe you're gonna get a little gut punch, but that's okay, right? I think that's life. It's how you when you get knocked down, how you get up, and you go through it. And thank God we went through it because I can't wait to get off this Zoom right now and go tackle my boys and watch the Nick game, right? So it's like all that stuff is all worth it at the end of the day. All that struggle. But believe me, if there was any moment that I could have taken the shots or any moment that I could have dealt with all the bullshit that she had to deal with, I would do it every single day of my life, the rest of my life.
I mean, I don't think it's so different between men and women because I think having a diagnosis of infertility is a sucker punch. But, what I tell every single patient every single day is this is a disease. Some of it's genetic, some of it is age related, but infertility is a disease. And so it doesn't change how much
I
of a
never, I
man or
never had
woman.
that. No one ever said that to me, though. No one ever brought that up to me like this is a disease at all.
Would that have helped you?
Maybe I think maybe I would have felt a little okay. Well, like you get cancer sometimes. You get
Mm.
cancer, right? Like it's just when your ticket's punched, right? So unless there's other outside factors that you're constantly doing, that's gonna
Right.
allow it to happen. So maybe I would have taken it a little better if they said this is a disease that you have, and now we can get through it, right? Together, right? If you get diagnosed with cancer and it's these are the steps now to get through it on the other side. I think maybe you have a different approach. It was more of we didn't really know the cause, right? So it was just like this is what
Right.
you have. This is what's going on for you with you and your family. So you have to kind of these are the next steps, I guess. But maybe it would have made me feel a little better.
I mean, I try to focus on that because, my whole world is trying to help individuals and couples going through infertility not feel guilty, that they are the cause. I mean, you will never in my world hear the word fault. It's no one's fault. It's
But
it's anatomy, it's
I bet you that
physiology.
word gets thrown around way more behind closed doors
Oh
than
yeah. Yeah, it's always like, oh, you're going through fertility, whose fault is it? That's the first thing people hear. And it's so unfair and it's so hurtful and it's completely inaccurate.
There's actually a follow-up question about this, Brian. How couples could avoid turning infertility into a blame game? How did you guys do it?
there was sometimes there was a lot of moments where when things get hairy, people say things. But what was I going to do? I really had no leg to stand on, right? So I just had to kind of take it, and it wasn't often, but it did happen, right? You're in this situation because we are in this situation because. Um, but again, it was like your laptop's on your lap, or you wear tights when you train, or this and that, and stop working out as much, stop running marathons. I'm like, I have to change my whole life now. Like, is this what's really? If there was concrete evidence, right, of you wearing your tights when you train, or your underwear is too tight, or you running those marathons all the time, this is the problem. This is 100% the truth, and this is the proof. Yeah, I would have got behind it, but I never got behind any of that. I was like, that's not, I'm not an idiot. You can't just. I'm not sitting with my laptop on my lap 23 hours a day, or I'm not in tights 23 hours a day, right? So I never believed
I
it.
mean, do you really mean tights? You wear tights, huh?
Yeah, I go on my Instagram, you'll see some tights here and there. Maybe it was the tights, Shapiro. Maybe it was the tights.
No, probably not. I wouldn't think so. I mean, I feel your pain, man. Though I swim all the time, and nobody wants to see a 65-year-old man in a speedo. But yeah, do it anyway. Who cares?
Well, staying on this topic, Dr. Shapiro,
Yeah.
will lifestyle changes increases the chances of finding sperm after previous zero sperm count? My first microtesty produced only 3 non-motile sperms, and I'm planning a second microtesty.
Okay. So it really depends why the sperm count is that low. So if we already know we know for sure it's not a genetic cause, which you actually can't know for sure it's not genetic, but you can know for sure it's not obstructive or hormonal. So if it's not the piping and if it's not the hormones, it probably is genetic. Now, with one exception, men who are very, very overweight make estrogen in fat. And when you make estrogen, and men make a little bit, but when you make a lot, it goes to your brain and it shuts off the two hormones, especially FSH, but it shuts it off so that there's no signal to the testicle to make the sperm. Same as if you're taking testosterone. And so weight loss and the GLP-1s really work for this, along with carbohydrate restriction. Totally works. But it's a regimen you got to stick to. And the GLP-1s, you got to take them either by shot once a week or the oral forms every day. But they do work. But you shouldn't be eating rice, pasta, potato, sugar, bread, or corn.
All the good stuff.
All the good stuff. Right. Bakery? Right. Pasta at Mama Leone's? Don't think so. So, but you can have a veggie diet. You can eat all the fruit you want. You can have lentils and peas. Those carbs are okay. And any fresh fruit and any vegetable based anything. You want to eat a ton of avocado? Go ahead. Some debate about dairy fat. There's actually publication that says dairy fat specifically is good for fertility. Hasn't been a lot of publication that validates that, but fattier diets are better for fertility in men too, especially in women, but in men too, because they lower your insulin. And when they lower your insulin, you have less endocrine disruption of the sex hormones. That's especially true in women, but it's partially true in men too. And men in PCOS is called syndrome X or metabolic syndrome. And so being heavy by itself is a problem. The GLP-1s with the carbohydrate restriction, you lose the weight, the suppression goes away, the sperm count comes up. Takes a while, but it works.
Thank you. And there's an update from Kyle and Candace. Ali, they're 33 weeks and 3 days along. Congratulations, you guys. We have a time for last question, and I know we have so many questions that we're not able to answer today, and I promise you we'll put them in our social media and we'll try to answer as many as possible. The last question for today, how much egg usually need for start fertilization, and if also want to save some eggs for later for second fertility?
Oh God, I guess that has to go to me. So it depends on how old the woman is. Okay. Generally speaking, if you want to be 90% sure you're going to get a baby, you need 3 embryos per baby. So 3 euploid, meaning genetically normal. So to get 3, and you want, let's say, 2 kids, you need 6. To get 6 when you're 27 years old, not that hard. To get 6 when you're 40, very hard. So the age of the woman really makes a difference. At 27, if you got 25 eggs, probably 70% would fertilize, give you 17, 18 embryos. Of those, probably, this is called the IVF funnel I'm describing, the attrition rate. From those, say 17 or 18 fertilized eggs, you probably get 10 or 12 blastocysts, which I happen to have a hand-drawn picture that I show all my patients when we do telemedicine. That's a blastocyst. Forget the color coding. That's the goal of therapy. Day 5 or 6 is what the embryo will look like. Those are the ones we can genetically test. then the age determines what percentage are going to be normal. So let's go back to 25 eggs at 27 years old, 17, 18 embryos, 10 to 12 blastocysts. At 27, 7 or 8 of those are probably going to be normal. So you're going to have enough for 2 kids, maybe 3 from one cycle. But those same 25 eggs from a 40-year-old, assume they go through all of that the same way, you're going to get 1, 2, and if you're lucky, 3 normal embryos. About 1 out of 4. So probably 1, very likely 2. 3 might be a stretch. And so there might be enough for 1 baby, but you got to get 25 eggs to start. And most 40-year-olds, unfortunately, they're not capable of making 25 eggs. Average egg yield at age 40 is probably about 5 to 8 in a good cycle. And so how many eggs do you need? If you're above 35, you need more and more and more, but there's no specific answer because there's still a random element to this. The younger you are, the fewer you need to get what you ultimately want.
Thank you, Dr. Shapiro. And we came, to the end of our webinar at the time, but I wanted to ask Brian if you can, maybe give one piece of advice to patients who were in a similar situation, just in the beginning of the journey, with the diagnosis stage. What would you tell them?
On the male side, never give up. Be a good partner. Try to be as supportive as possible, and go to every appointment.
That's great advice.
Can I just add something that Kyle taught me when we met him in Texas? He says to every man he meets, get tested.
Yeah, early.
Early, long before your partner goes
18,
through a lot.
19, 20, if you can.
Get tested. I mean,
Right.
counts
I
can
like
go
to go
down
to
or
every
up, but
appointment. Yeah. The advice to go to every appointment, that's great advice.
yeah,
It's hard, but it's great advice.
yeah, I agree.
Well, thank you, everybody. This was great.
Thank
Thank
you.
you, Brian.
Good luck, everyone.
Go,
And
go tackle your little rockets.
I know I can't wait. Let's go, Knicks.
Go Knicks, right.
Have a good evening,
Have a great
everyone.
night.
Bye.
Bye, everybody.
Bye.